Okay, so minerals like iron and zinc have been linked to fertility. So with women, iron and zinc are both needed for normal ovulation processes to occur. And consumption of, remember we talked about this, the non-heme type of iron also improves fertility. And where do we get that non-heme? That's going to be from our vegetables, okay? Very, very important. In men, zinc is important because it's a cofactor in different antioxidant reactions, and those help to produce sperm. Zinc also is required for sexual maturation and for the production of sperm, as well as for other reproductive hormones. So the use of iron supplements before conception has been linked to improved ovulatory function and better fertility. So this is really important to know because let's say you have a woman who doesn't eat a lot of red meat and she's iron deficient, and a lot of women are, and she's in those reproductive years trying to have a baby and not taking any iron supplements. So taking iron supplements in and of itself could improve her ability to get pregnant. Now, we've talked about dietary fat, and again, really important, you don't want that excess fat on the body. So you especially want to make sure that your levels of trans fats are super duper low. And if you're going to eat saturated fat in your diet, you want those saturated fats coming from healthy sources. You don't want to be taking these massive amounts of low nutrient carbohydrates and just converting those into fat in the diet. So for women, a high intake of fat especially, and a high intake of those simple carbohydrates is going to promote insulin resistance, and you're going to have all those ovulation problems. And for men, that high intake is linked to poor sperm quality. So think about that too. Not only do we need to make sure we produce enough sperm, but we need to make sure that those sperm are nice and healthy. And the male is producing those sperm constantly. So it's not like the female who those eggs were there from the beginning. And so we need to make sure that the man has all that good nutrition and pretty much constant, okay? And that's a big issue with Americans, isn't it? So replace pizza and fast foods with plant and fish oils, and increase those omega-3 fatty acids, okay? Especially in the male to help improve that sperm quality. Okay, so alcohol. So one of the things that you got to think about is how healthy is alcohol? And it's really interesting because in the United States, we just say, you know, stay away from it. Don't drink any alcohol. Don't have anything to do with it. Just avoid it. And we usually say avoid it if you're already pregnant, or avoid it if you're trying to get pregnant. But the problem is, again, we said this in the beginning, a lot of women don't even know when they become pregnant. So, okay, you want to be really safe? By the time you're able to become pregnant to the time you can't become pregnant anymore, you probably shouldn't drink alcohol. Okay, well, that's not going to happen. So if a person is drinking alcohol, one of the things we want to make sure is that they're not consuming a lot of alcohol, especially all at once. The binge drinking, like, okay, I don't drink all week, 5 days a week, but then on the weekends I go out and I drink, 24 beers in a row. And that's not nearly as good as, okay, well, I have like a small glass of wine each night with my dinner. So the binge drinking is potentially going to create more problems than having a small glass of wine, let's say, with dinner. So the higher the alcohol consumption, in a day especially, the more we know that it reduces fertility, it decreases those levels of reproductive hormones like estrogen and testosterone, progesterone, and then that can disrupt the menstrual cycle, it can disrupt ovulation, disrupt sperm production. All right, so interestingly enough, nurses have observed how women who have fertility issues have been eating. And so they did like this big nurses' health study, and they called, when the nurses were done with it, they said, okay, this is what we're going to call a fertility diet. Okay, so here's the recommendations for a nurse's fertility diet. So avoid trans fats, which we already know. They recommend you use more unsaturated fats, eat more vegetable proteins, which of course, duh, Americans don't eat enough vegetables, right? Choose low and slow carbohydrates, which basically that means that these carbs have a low glycemic index. It's much more difficult for us to digest them because they have a lot of fiber in it, okay? And we know that that fiber and those carbohydrates go hand in hand to keep our blood sugar levels low. Temporarily trade in the low-fat, fat-free dairy products for the full-fat version. Now, isn't that interesting? Because we're told constantly, if you're going to be healthy, you have to eat low-fat, you have to eat fat-free dairy products. But here's the issue. If I don't have enough fat in my diet, I can't produce those steroid hormones. They're based on fat. I can't produce my estrogen, testosterone, progesterone, and so on. So use the multivitamins, make sure you're taking your minerals, especially make sure folic acid is in there. Make sure you have enough iron. And a lot of people do not recommend red meat, okay? Now, if you are going to eat your red meat, try to eat red meat that is organic, grass-fed red meat. That's going to be the best for you. Lots of water. Water, 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 water. Make sure you're not drinking as much in the way of coffee, tea, alcohol. Lower the caffeinated beverages, okay? Now, here's the other interesting thing. You don't want to drink a lot of diet products because these diet products contain chemicals that can decrease fertility, okay? And there have been some studies that have intimated that some of these unsweetened diet beverages can actually increase autism. So that's kind of an interesting thing as well. So you don't want to take those or drink those, whatever, when you're trying to get pregnant because you might get pregnant and then does that cause autism? Not totally sure. And then, talked about this already, if you're overweight, you want to try to lose between 5 to 10% of your body weight, typically that keto or modified keto, and then incorporate exercise, and usually moderate. Now, interesting, a lot of people very, very out of shape. And I was reading something the other day where they were looking at how many steps a person needs to take, and they weren't even talking about how fast you go, uphill, anything like that. And usually they tell you if you can take about 10,000 steps a day, you're doing really, really well. But this research that they did was looking at people who were actually taking between 15 and 20,000 steps a day. Now, whether they were doing it on a treadmill or just walking around or whatever, those people, without even modifying their diet at all, were actually able to lose weight. So I thought, oh, that's pretty interesting. And it could just be very moderate, low-key walking on a treadmill. Now, of course, that's a lot of walking, but apparently very, very good for you, low impact. And now, especially if you're talking about, if you're working with patients, and especially if these patients are seriously obese, they might not be able to do anything but moderate, low-key walking. which proves to be very helpful. Now, of course, here's the other thing too. They don't have to do it all at one time. Okay? You could do 10 minutes here, 15 minutes there, 10 minutes someplace else, and very slowly but consistently incorporate more and more and more steps in your day. Because again, 15 to 20,000 steps, that can hurt the feet. Okay? Okay, so now, let's say she gets pregnant. Okay? Now we need to talk about prenatal growth and development. So we're going to talk about, what's the placenta doing for us? We're going to describe how risks for fetal malformations can occur. And during each trimester, what's going on? What organs are being formed? What do I need to be eating? And during which trimester does fetal growth increase the most? So, first trimester, really early growth. Now, normal pregnancy, typically 38 to 40 weeks of pregnancy. Okay, that's your typical pregnancy. So the first 13 to 14 weeks of pregnancy is the first trimester. Now, you have rapid growth, okay, because you're going from this one cell to a much larger organism. So there's a rapid increase in the number of cells and, of course, the size of this growing embryo. Now, you would think that during this time, it's not that big of a deal, but really, this is a huge time for nutrition and to keep the toxins away. And unfortunately, this is also a huge time where a lot of women don't even know they're pregnant. So there's a lot of women, again, who have no clue they're pregnant for 3-4 months because, okay, a lot of women have unusual menstrual cycles. They don't have every 28 days they have a period. That's not how a lot of women are. So they might not even notice if they don't have a menstrual cycle for a few months. So that nutritional deficiency, any toxicities the woman can come into contact with could be very harmful to the embryo and to allowing her to maintain that pregnancy. Now, those toxins I'm talking about are things like alcohol in high concentrations, cigarettes, any other type of legal or illegal medications that the woman could be using. By the way, those types of things can also affect the sperm. So it's not just the woman needs to be careful, but we know that alcohol, things like cocaine, marijuana, they affect the health of the sperm as well. So the egg could be fine and mom could be, doing everything she's supposed to do, but if the sperm isn't healthy, you have serious issues as well. So again, we need to be careful about that medication, but you don't want to be exposed to radiation. So, you go into that dentist and they ask you, oh, we got to take x-rays. Is there any chance you could be pregnant? And you say, oh, no way, there's no way. And then you are. Now, there could be some serious issues there. And of course, trauma, to the mom is not a good thing. So about half of all pregnancies miscarry during the first trimester. Now, miscarry could just simply be because that egg or that sperm initially were not all that healthy, and so the embryo just didn't form right, and very normally a miscarriage occurs, and mom never even knew she was pregnant. She never even noticed that she was pregnant, and during her menstrual cycle, nothing unusual occurred. She might have had a little bit of a blood clot, but didn't really know that the pregnancy even happened. And that is very normal, happens a lot. But of course, it could also be that there were other issues. Maybe the embryo miscarried again because mom had a nutritional deficiency, or maybe again the sperm wasn't healthy. So quality nutrition is very, very important, especially during this first trimester. So when we look at this embryo, okay, it's growing, and eventually you'll produce enough cells that you're going to now have what we would refer to as a fetus, okay? So one of the things that has to grow inside that uterus and surrounds that baby that's growing is the placenta. And you can see in this picture here, you have the umbilical cord that attaches from the placenta to the baby. And now the placenta is attached on the inside of the uterus. Now that placenta is very important because it's going to produce a whole bunch of hormones that help to maintain the baby's health. And it also is kind of an interface between mom and baby. It helps with exchange of nutrients. It helps with exchange of oxygen. Make sure baby has enough of everything that he or she, or they, for that matter, need. So, first trimester, within the first 30 hours of pregnancy, we have this zygote, okay? This divides in half to form 2 daughter cells. So basically the zygote is where the egg and the sperm get together and you have this fertilized egg. That's your zygote. And then immediately it's going to divide and you have these 2 cells. Now, okay, those 2 cells that divided should stay together, okay? And then they'll divide into 4 and they'll divide and divide and divide and divide. Sometimes when those 2 cells divide, they separate. If they do, now you have 2 babies, okay? And now you have the twins that are going to occur. Within 4 days, those cells have divided enough that you have 128 cells. At 14 days, you have enough cells that you now call this an embryo. At 35 days, okay, within the first month, the heart is beating, and the embryo, teeny, teeny, tiny, about 1/30th of an inch. Okay, that's its length. It does have eyes, and it does have what we call little limb buds. It has these little teeny tiny things protruding out that kind of sort of make it look like it has limbs. It sort of looks like a tadpole at this point. At 8 weeks, the embryo is now known as a fetus. There's enough cells and enough organs have developed. At 13 weeks, most of the organs are fully formed and the fetus can move. So this is the end of our first trimester, which also means the neurological system and as well as the cardiovascular system, all of those have formed. Okay, so we're looking at this picture of vulnerable periods of fetal development. Okay, so on the far left here, you have the egg and the sperm unite. And this is, of course, preconception where the 2 are apart. And then conception is is then going to allow us to produce a fertilized egg or our zygote that's going to divide into 2 and keep dividing and keep dividing. Now, remember I told you had those little limb buds? So that's kind of what we're looking at here. And you see them a little bit better there with its little tail. Sort of kind of looks like a tadpole here. And it weighs less than 1 gram, okay? That's tiny in our embryonic development. And then as we continue to develop, the neurological system is developing more. And the reason that it's folded over like this is because the brain is actually going to wrap around, almost sort of like a jelly roll. It wraps around in order to produce the brain that we have. Those limb buds are getting bigger, okay? And eventually, we're going to now go into the second trimester, and we're going to see more and more development until we've got that pretty much formed baby in the 3rd trimester who's just growing and growing. So each of these different zygote formation to the embryo in the 1st and the 2nd trimester, there are variable periods where the embryo, the fetus, is very susceptible to what we would call certain insults. So certain chemicals or certain lack of nutrition can cause more problems than in other periods of development. So, harmful effects of toxic agents. Okay, so we're looking again. This is the preconception, the zygote, embryonic development, fetal development, okay? And these are the different organ systems. So, central nervous system, heart, limbs, eyes, ears, the palate, the teeth, the external genitalia. So in purple shading, okay, is time of greatest risk to these various organs. The most serious damage to the fetus is likely to occur during the first 8 weeks after conception. So during the embryonic development into the second trimester, lots of potential damage could occur if toxins are introduced to the body, to the central nervous system. After a little while in embryonic development in the first trimester, not so much damage to the heart or the limbs, even the eyes. But notice, even into the second trimester, even the external genitalia, a little bit of interesting, the ears, these all can have damage, okay? The white bars show damage to vital parts of the body, including the eyes, brain, genitalia, can occur during the later months of pregnancy. So even here in the white, again, the eyes and the external genitalia, the neurological system, that's all potentially going to be damaged during the second and third trimester. So you can see, especially the central nervous system, super delicate. And of course, the eyes are kind of sort of part of that, very neurological, very, very delicate to insults. The second trimester, so this is after the 13 weeks of gestation. The fetus weighs about 1 ounce and is about the size of a lemon. The fetus, you can look at it now and you can see it looks more like a baby. It has a nose and eyes and ears and hands and feet. Doesn't look like a tadpole anymore. Still susceptible to toxin exposure. And of course, here's the other interesting thing. The body is being prepared for that baby to be born. So, of course, one of the preparations is lactation. So you have to increase the amount of milk-producing cells in the breasts, and we are also increasing the amount of fat in the breasts because that fat is going to be able to lend to the breast milk high dense nutrients, okay? So we need to have plenty of fat in the breast tissue in order for that fat to then be able to enter into the breast milk. So any type of nutritional deficiency at this time also will, believe it or not, affect breastfeeding later on. So you want to make sure that mom is eating appropriately through all 9 months. The third trimester is the most rapid growth phase. And at the beginning of this trimester, the fetus weighs about 2 to 3 pounds. It's about as big as a head of lettuce. But we know that the fetus is going to double in length during this third trimester and could potentially even triple or quadruple in weight during this time. Okay? So mom is obviously going to be transferring all kinds of nutrients to the baby, but there's going to be a lot of fat transfer. Calcium is really necessary, and iron is necessary during that final last month, you might say, or that last push of growth for this fetus. So iron is so necessary for the fetus that mom may end up having a depletion in iron. So that's one of the reasons why doctors make sure that those prenatal vitamins are packed full of iron for mom. A full-term fetus can weigh anywhere from about 7 pounds to 9 pounds, usually is at least 20 inches long or somewhere thereabouts, give or take a little bit. Okay, so just something to kind of think about for success in pregnancy. How would you define success in pregnancy? And then you really should be able to define preterm, low birth weight, small for gestational age, which we're going to go through all of those. How is maternal age related to the outcome of pregnancy? And is attention to good nutrition during pregnancy really worth the effort? I mean, why can't I eat candy and cupcakes and have a good pregnancy? Okay? So we'll talk about all that. Cute baby. All right, so we're going to talk about success in pregnancy and what's called the fetal origins hypothesis. So one of the things that scientists have hypothesized is that the health of a baby, of course, depends on the health of mom and the health of dad, and how these guys are able to stay healthy in their lives and then pass on that health to the baby. Okay, makes total sense. And then, of course, the later in gestation a baby is born, the more success that infant is going to have in survival. And one of the reasons why there's going to be so much success is that the lungs are going to develop appropriately, and those lungs are a big deal. The lungs are pretty much the last organ as far as fetal development is concerned, are going to develop in the body, and so they're pretty slow to develop. And so you don't want baby born too early because those lungs may not develop. And this is one of the #1 causes of death in a fetus is that, in a neonate, is that they have respiratory distress. So the longer the gestation is, the less the health risks are going to be. Now, of course, one of the other things that's really important is you have to look at epigenetics as well. So is this all about just mom and dad taking care of themselves, or is this also grandma and grandpa taking care of themselves in order to make sure that baby is born healthy as well? So it's not just about that 9 months of gestation. So we also want that baby to be more than about 5.5 pounds. So the larger the baby is at birth, the greater the success in pregnancy. So we don't want a low birth weight infant, okay? Low birth weight signals lots of problems, and potentially low birth weight signals that the infant is not going to survive, okay? So again, usually under 5.5 pounds, usually due to preterm birth. And of course, when we're talking about a baby who is born early, there's going to be potentially a lot of medical costs because baby's going to have to stay in the hospital for long periods of time. I had a cousin many years ago who was born and she weighed less than a pound, and she spent about the first 5 months of her life in the neonatal intensive care unit. And obviously this was a long time ago, but when her parents received the bill, it was almost $1 million back then, and they had absolutely no insurance whatsoever. So lots of reasons why, and of course the #1 reason is we want a healthy, happy, long living child. So if we have a low birth weight child, we have a child who potentially could be small for gestational age. So let's say the baby's full term, but still low birth weight. Okay, doesn't necessarily have to be a baby that was born premature to have a low birth weight. Okay, so one of the things that we see when they're small for gestational age is that they may have been exposed to a toxin. A really big one is cigarette smoke. Okay, or nowadays lots of people think it's okay to smoke marijuana, and smoking marijuana while pregnant is not a good thing for this developing fetus. It is extremely bad, and small for gestational age is a big problem. They are born with low birth weight, so you have to be careful of the toxins. Lack of nutrition can also cause small for gestational age. And more likely than normal weight infants, these small for gestational age infants are going to have medical complications, okay? And some of these are going to be long-lasting medical complications. So they could have feeding issues, and they can have what we call failure to thrive. So they don't want to eat, they don't want to interact, they just are very listless, they sort of lay there, they don't want to do anything. You could have problems with glucose regulation, temperature regulation, especially because they're small. The organs may not all be developed. They may not have enough fat on their body to keep the temperature up. And then, of course, the small for gestational age infants also typically have slow growth and development after being born. So we don't want this to happen, okay? So one of the things that's highly recommended, prenatal care, prenatal counseling, helps to determine a very successful pregnancy, a very healthy, happy newborn infant. So a woman is 3 times more likely to deliver a low birth weight baby, who will be 40 times more likely to die in the first 4 weeks of life if she doesn't have prenatal care. That's huge. I mean, that's really, really big. So some of the untreated health conditions could be in mom, anemia, if she has AIDS, hypertension, diabetes. These are all really big problems that mom may have, which would then become a bigger complication for mom because she's pregnant, and then also a complication for the developing baby. So the goal is we want to try to increase healthy women and to make sure they have really good prenatal care, especially in the first trimester of pregnancy. Now, again, let me just kind of emphasize this. That might be a little hard to do if she doesn't know she's pregnant. Okay, so one of the other problems is getting pregnant young. So if you're a teenager or even younger and you become pregnant, this increases the risk of a negative outcome. And that negative outcome can be for mom, it can also be for baby, okay? So really, we want to have babies between the age of like 25 to 35, and that's usually because below the age of 20, the woman's body is not well developed, or the child's body is not well developed. And over the age of 35, sorry ladies, but we call that a geriatric pregnancy. And so it can also be very dangerous for mom or child the older you become. Okay, so just to know that. For the mom, okay, if she's young, it can increase the possibility of depression, or if mom already has pre-existing mental health conditions, they can exacerbate that. There's a higher chance that mom, if she's a teenager, could be using illicit drugs or excessive amount of alcohol. I hate to say this, but a lot of teenagers who get pregnant, statistically speaking, come from poverty. And of course, we're talking about nutrition, okay? The more in poverty a person is, the less likely they're going to be able to eat well, okay? Also, it decreases your chances of graduating from high school or college because, of course, you're a single parent. Now you got to go to work, take care of this kid. It's really hard to go to high school and to go to college and to take care of children. It can be done. Don't get me wrong. It can be done. I can tell you, although I was married, I had kids very young, and I went through college. By the time I got out of college, I had 3 children of my own, and we'd already adopted 2. So I know, a little bit crazy, but it can be done, okay? But it does make it difficult. It is really hard. Now for the baby, unfortunately, because of the possibility of toxins being introduced into mom, or because of poor nutrition, birth weight is possibly going to be lower. There's an increased risk of premature delivery, which of course increases infant mortality, and it also increases problems with the infant. So There could be more diseases or more problems with the child as they grow up. Depending on if these problems affect the neurological system, could decrease academic performance, increase the risk of autism, increase the risk of ADHD, and then, believe it or not, it increases the risk of the child going to prison. So that's an interesting statistic. All right, so now, I just love this picture. Those two babies look so happy. Multiples or closely spaced babies, okay, what we used to refer to as Irish twins, okay, where mom delivers and then 9 months later, mom delivers again, okay, so very closely spaced babies. So siblings born with less than a year between them is what we would refer to as a closely spaced baby, okay? And now, these babies are more likely to be born at low birth weight than if we space them farther apart. Okay, so now why is that? Well, mom really didn't have time to rest and relax and rebuild her body again so that she can have a nice, healthy pregnancy. That becomes a big issue, okay? And so you want to try to space the children out. Usually your OBGYN is going to tell you try to wait at least 6 months before you get pregnant again so that the body can heal and rebuild and make sure you're ready for that next pregnancy. Now, multiples, okay, so we're talking twins or more, okay? Something really weird about multiples, okay? Usually, let's say you have twins, all right? One twin is a strong, greedy cuss, okay? That twin somehow, and scientists don't understand how this occurs quite yet, but that twin somehow is able to totally suck nutrition off of mom, get enough oxygen, and be super uber healthy. As a matter of fact, that twin a lot of times comes out roly-poly, okay, and is big for its normal size. And then the next twin who comes out is usually tiny, low birth weight, sort of unnutritious, feeble looking. And now let's say you've got multiples. Let's say they have triplets. Again, the first one, super healthy. The second one, smaller. The third one, you ever heard the runt of the litter? That's what you're going to see. So for one reason or another, these children, these fetuses, as they're growing inside mom, some of them are able to suck nutrition and get nutrition off of mom better than others. And again, we don't know why, but that does happen. So there's a higher risk for premature birth because of this disequilibrium of nutrition.